Do you wake up with knees that ache first thing in the morning and worry that your knees are going to be in agony as you walk to the bathroom? You know that feeling. You roll out of bed, take that first step, and think, oh gosh, my knees and the rest of my joints just aren't cooperating. Most people assume it's just arthritis or that their knees are worn out from old age. But the truth is, knee pain has very little to do with structural damage and everything to do with how your brain and your body are communicating. Hey, I'm Drew, the knee pain magician. For the past 10 years, I've been working with active women in their 50s and 60s solve chronic knee pain without the use of injections or surgery. And what I've seen time and time again is that morning aches, pains, and stiffness is very common. However, it can be solved when you know the right exercises to do and when you have a better understanding of what's actually happening inside your body. When you wake up first thing in the morning, it's not at all uncommon to feel stiffness and soreness in your knees and other joints inside your body. Think about it. You've just been lying down, not moving your body for 8 hours or so, as your body shuts down to recover from the previous day's activity. So when you first stand up and try to get out of bed, your brain hasn't yet connected to those stabilizing systems that are so important to having pain-free knees. So your brain doesn't yet quite trust your body to move safely. And that lack of confidence creates stiffness, aches, and pains. The pain you feel isn't just from stiffness or arthritis though. It's a protective signal from your brain saying, hey, I'm just not quite ready for movement. And that's why only after a few minutes of walking, you initially start to feel a little bit better because your nervous system starts to wake up, your joints start to move, and your brain gets a message, okay, it's safe. Does that make sense? The problem is most people are told they need various injections to repair their knees or that they need to work on strengthening their glutes. But if the problem is coming from poor communication between your brain and your body, working on these other methods alone will only treat the symptoms of your problem rather than getting to the root cause. What your knees really need are a few gentle movements that help improve the connection between your brain and the problem area. Wake up your brain's connection of key joints that your knee depends on, and stimulate your visual system, which prepares your body for movement before you put the full weight on your knees. And once your brain senses it's connected to and confident about moving your knees, you can turn the pain signal off. And that's when relief comes. So before I coach you through 3 of my favorite exercises to help you take away the aches and pains and stiffness in the morning with your knees, what I want you to do is kind of check in and assess how you're currently feeling. So what can an assessment be? Well, you're probably watching this video at a different time of the day and not immediately when you get up in the morning, which is fine. I'll kind of show you 2 ways to think about it. The first thing is you want to pay attention to how your knee is currently feeling. So for you, imagine if you have left knee pain, you can bend and extend that left knee just to kind of see how that feels. Is it stiff? What's my level of pain? 1 to 10, 10 being a high level of pain, 1 being you feel great. You know, where does it hurt? How does it ache? Kind of give yourself a little bit of a grade, so to speak. What you can also do is just stand up, sit down, stand up, do that a few times and grade that. It's like, yeah, you know, out of a 10 being terrible, maybe that's about a 5 or a 6. If you were already kind of a little bit more active in the day while you're watching this video, you can stand up, go for a walk, kind of check in overall with your quality of movement, and again, give yourself a score. So I want you to do that before and after each exercise in order for you to tell what exercise helps you the best. So I'm going to show you 3 exercises that are really helpful to most people who are struggling with stiffness, aches, and pains in the morning, but one exercise may be a real winner for you compared to the rest. But in order for you to judge which that is, you have to be able to test after each one. So hopefully that makes sense to you. So believe it or not, the first exercise we're going to work on is your eyes. We're going to do something that's called a vision circle. So your visual system is one of the most important systems you can activate in order to reduce pain and stiffness in your knees. That's because your eyes give your brain so much awareness of what's going on in your world. Oftentimes we focus on where the pain is. I've got pain in my left knee. I'm going to work my left knee, do this, do that, do the other thing. And oftentimes the pain doesn't change. But that's because we're neglecting some of the higher order systems that our brain rewards more when they're working correctly. And that's your visual system. So what we're going to do is something called a visual circle, a vision circle. And all it is, you could do it first thing in the morning when you wake up and you're sitting down on your bed. Have a couple of stretches, do what you need to do, and you're going to take either a pen that's on your bedside table, or you can take your finger, and all you're going to do is trace a circle. Starting from 12, you're going to go to 3, then you're going to go to 6. Once you get to 6 o'clock, you can switch fingers. You go from 6 to 9, back to 12. And then I want to reverse and go from 12 to 9 to 6. And then from 6, I want to switch fingers and go to 3, back to 12. All you're doing is a nice circle, one direction and then the opposite direction. A couple things to notice where most people tend to go wrong with this technique. They move their head. Yeah, if you're moving the head, that means the eyes aren't getting the full range of motion. Sometimes people hold their breath, right? So we want to make sure that we're nice and relaxed posture, we're breathing and just kind of taking it easy. Main thing we're trying to do in this exercise, keep your eyes rather locked on the target as it's moving in a full circular motion. Just like this, pretty simple. My eyes are following up, out to the side, beneath me. If you notice that your head is starting to move and follow, and it's kind of difficult for you to prevent that from happening, just hold your chin with the non-moving arm. You can switch. Yep. So that's all the exercise is. If you did 3 circles each direction, clockwise, counterclockwise, I think that could be one great exercise for you to bring immediate relief to pain, stiffness, aches in your knees. After you've done the vision circles, I want you to reassess your knees. You could bend and extend. Oh, wow, okay, I've got greater range of motion. I've got less pain, less stiffness. Maybe you stand up, sit back down, do that a few times. Again, if you're more active during the day while you're watching this video, you could go for a longer walk, try a few steps. And again, we're looking for what exercise is giving you the best results. So that's exercise number 1. Okay, so exercise number 2, we're going to do something called skin stimulation. Exercise describes what you're doing perfectly, which is stimulating your skin. So what I have is a nail brush. This is a bamboo brush. If you have something like this, perfect. If not, you could also use just a regular hairbrush or even a fork, believe it or not. So ideally what you want is something sharp that's going to help stimulate your skin and bring awareness for your brain and your nervous system to the area where you're having some trouble. So with your brush, obviously I have my pants on. Imagine that you're waking up first thing in the morning and maybe you don't have full-length pajamas. You could still get benefit from doing the exercise if you have something that's sharp over some cloth. But ideally, you're going to do this exercise on bare skin. So again, saying you've got issues with the left knee, have a lot of pains and stiffness, aches, deep aches in the morning, you're going to take that brush, whatever your instrument is. If you don't have anything while you're watching this video, you can also just take your hands. But you're going to take that brush, and I want you to brush all over that knee. Kneecap, beneath the kneecap, inside of the knee, above the knee, outside of the knee, behind the knee. Really every little nook and cranny, every inch, I really want you to stimulate that skin. If you've got a brush, you're doing just like this. If you have a fork, you're going to be gently poking around the same area all over. Very thorough, making sure you're really getting a kind of a good working in on it all around the area. You've got aches, pain, stiffness, etc. So believe it or not, a simple tool like this, whether you've got a dry brush or you're using your hands, this simple movement can have a huge impact, immediate impact on reducing your pain, reducing your stiffness, and allowing you to stand up with more freedom of movement. So after we finish that exercise, maybe you spent 15, 30 seconds doing a little bit of skin stimulation on your problem knee or problem knees. You're going to reassess and see how your body responds to that. So that would be potentially bending and extending that knee. So I can say just after doing that, that I feel like I'm able to bend and extend my knee with more freedom. You can stand up, sit down, do that a few times. Again, if you're watching this video during the day, you may go for a longer walk, try a few stairs. And again, you're testing to see which exercise out of the three kind of gives you the best results. So that's exercise number 2, skin stimulation. Okay, so for our third and final exercise, after you've done the assessment from the previous one, we're going to work on your foot and your ankle. Foot and the ankle are really underrated for providing amazing amount of relief and really a lasting solution for people who are struggling with chronic aches, pain, stiffness in their knees. Again, oftentimes we focus on where we're having the problem or where we're experiencing the problem, and we're not really thinking about where the problem is actually coming from. If you have a lack of mobility, lack of sensation, or other issues within your toes, foot, and your ankle, that's the area that provides stability for your knee. So we want to make sure that you always have really good coordination and movement within the foot and the ankle, because that provides a lot of relief and safety for the knee. So one of my favorite exercises for the foot and the ankle is a ankle circle. Super simple. You may already do this at home, but what you're going to be doing is, again, isolating the foot, and you're just going to be drawing a small circle with your ankle. And so what I'm doing is a clockwise circle. And I want you to see that as my foot goes up, my toes go up. And as my foot goes down, my toes go down. So I'm not moving my whole leg. I'm isolating my foot. And I just want to get some really good movement in the ankle. Try to get a full range of motion. Raising my toes, feeling them, engaging them. Flexing my toes, feeling the bottom of my arch. And I want to make sure I go both directions. So try to be smooth, coordinated. Pay attention to what your toes are doing. Incorporate them into the movement. And maybe you want to do 5 to 10 circles first thing in the morning as your last exercise before you get out of bed. And again, both directions. Clockwise, counterclockwise. Take your time, go slow. Make sure that you're moving the full foot and ankle 360 degrees as much as you can, one direction and then the other. And again, paying attention to the toes and the foot and what's going on with that whole movement. So after you've done that, of course, you're going to reassess. You're going to stand back up, or actually maybe the first thing you do is bend and extend that knee. Okay, yeah, that feels a little bit less stiff. Some of that deep ache is gone. I'm going to stand up, sit down, do that a few times. Yeah, okay, I do feel a little bit more steady on my feet, whatever it may be. So that's our third exercise. It's called an ankle circle. I want you to do clockwise and counterclockwise on each side of your body that where you're having knee pain, and maybe you do 5 to 10 repetitions. So here's a real world example that can help drive the point home about why these exercises are valuable and how it can change your morning routine. One of my clients used to tell me she used to dread getting out of bed every morning. She would shuffle to the kitchen, holding onto the wall, thinking to herself, is this what I'm going to have to deal with, being diagnosed with advanced osteoarthritis? But when we helped her reset her nervous system first thing in the morning with simple exercises like these, her discomfort became much more manageable. The deep aches reduced, the stiffness reduced, the chronic pain began to go away. Now she's able to wake up in the morning, move freely, and go about her day, and she actually looks forward to her mornings again. So if your mornings have become one of the hardest parts of your day, it's not because you have bone on bone or that your knees are too far gone. It's simply your brain asking for more communication from the rest of your body. And once we restore that, you can move confidently again. No injections, no surgery, and no fear when you wake up, play pickleball, or travel with your partner. So if you'd like help to figure out exactly what's the real reason of why you've been struggling with chronic knee pain for so long, all you have to do is click the link below and schedule a free knee pain assessment with me. And let's get your mornings and your confidence back. That's it for me this week. Hope you enjoyed our video, and talk to you soon. Bye-bye.